This video will cover Myelokathexis-WHIM syndrome, which may lead to disorders of marrow production. To anchor ourselves, let's use this swimming competition, because WHIM sounds like swim, doesn't it? I don't know if this is the lifeguard's kid or what, but he's just chilling there sitting crisscross. Sitting crisscross represents CXCR4 gene, mutations in this disease. You could shorten crisscross to CXCR, right? Also, he must be the lifeguard kid because notice how he is lifeguard number 4 to make things even easier for us to remember. Next, you see how the lifeguard has all these skin lesions? To me, they kind of look like warts from here. This represents that the W in WHIM syndrome means warts, a common finding in affected individuals. The next letter H is represented by that empty bag of gummy gators our lifeguard is holding. The H means hypogammaglobulinemia, and aren't gummy gators similar to gamma globulin? The fact that the bag is empty will help us remember low gamma globulins. And of course, this also represents the next letter I, which means immunodeficiency. The last letter M means myelokathexis, and it is represented by our lifeguard enjoying some tasty apples while reading his thesis book. Apple in Greek is Milo, which sounds like Milo, and since he's reading a thesis book, it'll help us remember myelokathexis. Myelokathexis is a term that describes the retention of neutrophils within the bone marrow due to inability to migrate into the peripheral blood. Next, we have our newt here. But he looks abnormal compared to our other newts from other videos, right? He's got all these colored thin filaments on him. This is because these patients have abnormal neutrophil function that is characterized by hypersegmented pycnotic nuclei with fine chromatin filaments. Let's break this down. Hypersegmented is represented by the newt being hyperfixated on that segue. Pycnotic is represented by those X's on his eyes. And the fine chromatin filaments are represented by all those fine lines on its body. Altogether, this morphology is distinctive of this disease and worth remembering. The next thing to remember is the fact that these patients have reduced BCL-X expression. It is represented in this video by this poster of a buck with a red X on it. Look, this is just a way for us to remember this disease. Don't come at me trying to cancel me saying I'm against hunting. I digress. So, maybe the lifeguard's name is Michael, because it looks like he's getting some special treatment. See that sign that says no late fees for Michael? This represents mycophenolate, which sounds a lot like Michael and late fees, right? It's important to remember that patients on mycophenolate can have a similar neutrophil morphology to these patients. So before considering this disease, consider if the patient is on mycophenolate.